Hello viewers, I am Dr. Himanish, consultant pediatrician, Bhagirathi, Neotia, Women and Child Hospital, Newtown. So today we are going to discuss a very important topic and very relevant topic, that is the care of children during this COVID pandemic and how the children are affected, and gradually we will discuss about the sign and symptom and when to consult a doctor by the parents. So the first question comes in the mind of children, the doctor, our children are not going outside, so how can they get infection? Well, the children are not going outside, but we are going outside. So children can acquire infection from their parents, from grandparents, from the person coming to their home and all this. So we have to be very careful while handling the children and while coming back from outside. The next the question is that who are the very high risk group of children? So first, there are some children who are very high risk. First is the children below 1 year. The children below 1 year are at very high risk. The second group is the children with congenital heart disease. Third, any children undergoing any kidney disease treatment on high steroid. And fourth is high obesity. The children who are very much obese are in very high risk of getting COVID. So what are the signs and symptoms by which we can understand the child has been suffering from COVID? So we have divided the symptoms in three categories. First is mild symptom, moderate symptom and very severe symptom. So what are the mild symptoms? Mild symptoms are fever, cough and cold, coryza, sneezing, body ache, okay? And what are the moderate symptoms? The moderate symptoms are breathing difficulty or first breathing. So how can we understand that the child is breathing first? So if the child is below 2 months, the rate of breathing, that is the chest and the abdomen coming up and down, that's why you can count the breathing. It is more than 60 in a children below 2 months. Then 2 to 12 months, the rate should be around 40 to 50. 1 year to 5 years, it should be around 30 to 40. So if the rate is more than that, we can tell that the child is having first breathing, and this falls in the category of moderate severe disease. And now the extremely severe symptoms. What are the signs of extremely severe symptoms? The first sign is heavy breathing, very high rate of breathing. Second, there is cyanosis, that is the face, fingers, all the bodies, the lips will get blue. So this is called cyanosis. The child can have some fits, it's called seizure. These things are categorized as a very severe signs and symptom. So what are the treatment and what can the parents do? So if the child is suffering from the mild symptoms, we can consult a doctor and we can treat the child at home. How? The child should be given a good hydration. He or she have to give lot of fluids orally. Paracetamol can be given with the prescription of your pediatrician. If needed, he or she can be given antibiotics as per the guideline of the pediatrician, and adequate rest. Okay. And what are the treatment of moderate to severe symptom? In moderate to severe symptom, it's better to treat the child in hospital, because when the first breathing starts and the cyanosis sets, the main mode of treatment is oxygen therapy. The child should be given oxygen with high frequency oxygen, normal face mask oxygen, and if necessary, if the symptoms are very much severe, we can give the ventilatory support also. So these are the treatment in nutshell of the COVID. Now we'll tell something about the prevention process. So it is very important from our point of view, as the children gets infected from the adults, we should regularly wash our hands. We should use the hand sanitizer before going to the children, and we should wear a mask while coming from outside, and we have to change our clothes regularly. The children who are little bit of elderly should encourage to use the mask, and he or she should be encouraged to use the sanitizer, okay, regular basis. And it is very important to boost the children because there is some lockdown situation nowadays. So we have to boost them mentally and physically. We have to give little bit of exercise at home. We have to do some type of exercise or mental exercise like drawing, antakshari, and all the things which will boost the child from inside. Okay, so it's very important. So thank you so much.